Hi, and welcome to my new NEQCA CEO update. We've heard from you that you'd like us to keep you informed, and so we're trying new things, and one of those are these new video updates that I'll be doing on a regular basis. It's been a very exciting year for NEQCA, and there are lots of things I'd like to share with you in this brief update. We continue to do very well in our contracts, and specifically our Blue Cross Blue Shield NEQCA contract. It looks like not only have we met the target for 2012, but we may have even exceeded it. When we started off in the Blue Cross Blue Shield contract, we were about at the bottom of the Blue Cross Blue Shield network in terms of gate score. We've gradually progressed. In 2011, we were about at the 50th percentile, and we're hoping this year we even exceed that and get to the top of the pack. So how have we done so well? There have been several lessons that we've learned, and I'd like to share those with you and let you know about some of the things that we notice our practices are doing that help them be successful. First of all, our practices that use data regularly tend to do the best. And specifically, I mean taking advantage of the registry, both from determining what patients need when they come into the office and using the reporting. Practices who enter clinical data into the registry also tend to do well so that they can follow the clinical data such as blood pressures and hemoglobin A1Cs and other clinical data. You should also know that we at NEQCA Central have been importing clinical data from various different electronic health records into the registry, again to make it easier and more effective for folks to use the registry. And so far we're getting very positive feedback on that clinical data transfer, and practices are using it very, very well. The other thing that groups do who are successful in the contracts is they use a team approach within the practices. So the practices are forming what are called clinical improvement teams, and that includes an administrative person, a clinical person such as a medical assistant or a nurse, and a physician lead. Now, it may seem a little silly for a small practice to create a team, but it's not, because what the teams do is they establish who is doing what by when. Then they meet on a regular basis and they see how they're doing. And so those practices where the team owns the work tend to do very, very well. Lastly, we find that practices who prepare for patient visits tend to succeed. And so someone in the practice is assigned to look at the patient's record before they come in and figure out what they need for that visit. And they'll communicate that to the physician either through something in the electronic health record or even on paper. Whatever works for your practice is fine, but preparing for the visits in advance is really key. Now, in terms of the efficiency side of the contract, the most important thing that you can do is to participate in our care management program. So for those of you who are at the Spring Quality Forum, you heard patients who are enrolled in the program and physicians who are engaged in the program talk about the benefits of the program and how they both find it valuable. Both patients and physicians. The patients are saying it's easier for them to take care of themselves, and the physicians are saying it's easier for them to take care of the patients. So please participate in that program and let us help you take care of the sickest patients in your practices. We're very excited about a new relationship that we have with our physicians in Metro West, and it's to support them in the Medicare's ACO model. Their organization, called the Collaborative Health Accountable Care Organization, it will be supported by NEQCA in several ways. We're going to be providing data analytics, data management, quality improvement support, and care management to help them be successful in this new model that Medicare is promoting across the country. The other item I'd like to update you on is that we received an $85,000 grant from Harvard Pilgrim under their Quality Grants program to work with our colleagues at Tufts Medical Center, their primary care department, and the Department of Psychiatry at Tufts to help figure out how do we integrate mental health care in patients who have chronic medical illnesses. So as you know, many patients with chronic illnesses have mental health comorbidities, and this will help us to learn how to take better care of those patients. Well, thanks for your attention, and most importantly, thanks for the great work out there in the community on behalf of our patients. We'd really love to hear how this format is working for you, and if there are other topics you'd like to hear about, and in general, how can we better communicate with you. Well, thanks again, and I hope you enjoy your day.